Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. I am so excited about today's episode because it ain't every day that I get to speak to the legendary Grammy-winning rapper Ice-T. You're probably wondering, wait, you're a doctor and a public health advocate. Why are you talking to one of the biggest hip hop artists in the world? Well, it turns out that Ice-T cares deeply about his health, and that includes getting the flu vaccine. The star of Law and Order SVU sat down to talk to me about the vaccine Fluzone, his partnership with Sanofi, his early military life, Black people's mistrust of health professionals, why women live longer, and much more. Let's get started. So let me just quickly introduce myself.
Okay.
I'm a doctor, Dr. Lipi Roy. I'm a Canadian born and bred from Toronto, but I now live in New York. I'm an internal medicine doctor by training, and I then specialized in addiction medicine. I was actually the former chief of addiction medicine for Rikers Island Jail, and then at the start of COVID, I was an MSNBC medical contributor. I also was medical director of COVID isolation and quarantine sites for Housing Works. So I talked about preventive health, vaccines all the time. So this is why I am thrilled to talk to you about this topic that's clearly important to both of us.
Mm-hmm.
So on that note, you recently partnered with global pharma and healthcare company Sanofi for their flu vaccine campaign. Why does influenza matter to you?
Well, the story goes like this. Sanofi had a campaign which is called the Season, and it's set up to look like it's a horror movie. So I did the voiceover for it, like to scare people and let people know the flu's
Yeah.
coming, but it was kind of a catch on the end. Well, when we started to work with them, they found out that like I've been taking the flu vaccine for like 25 years. I've always taken the flu shot. So I was like, yeah, I'll get involved, promote. I already was doing because I don't want to get sick. I hate getting sick. I've been on Law and Order for 24 years. I've never had a sick day. I got a 7-year-old kid who I don't want her to get sick, and she comes. Those kids are like petri dishes for every type of sickness coming home from school.
Totally. They are
So
vectors for disease.
exactly. So my household, we were very much into getting flu shots every year. So it was normal for me. And then Sanofi told me, they said, well, look, we have the Fluzone high dose vaccine for you since you're 65. And I'm like, well, I want that, because I'm trying to stay healthy. And it was a chance for me not only to promote a flu vaccine, but to promote male health and awareness because, I make the joke that, Coco talks to her gynecologist if she breaks a nail. Women are so in tune with their bodies, but men, we have to be on a slab before we go check it out. So that's why
Right.
it was easy for me to get involved with them because it was something I naturally do.
Well, and what a great segue to really my next question, and you kind of answered, which was, what's your personal experience with vaccines? I remember you saying you had shared that earlier in your life, you were in the military, you were in the army, and while you were in service, you guys got vaccinated all the time before you went abroad, and you said that protected you.
Well, absolutely. It's just, you're in the army and you're getting ready to go someplace like Panama, you're getting ready to go someplace. You stand in line, they actually give you vaccine with like this air gun, like bow, bow, bow. It's like
Yeah.
it's like an
Yeah.
assembly line.
Yeah.
But you definitely don't want to catch malaria. You don't want to go through. One thing about I was in infantry. One thing about being in the field, it's hard enough without being sick. If you get sick, you might be way out there. You may not be able to get back, and you're going to suffer. So of course, we're taking everything we can just to stay healthy. But I just never had a problem with it. I mean, I think vaccines are taboo now, right now, after COVID, where they tried to mandate it. And humans just hate having anybody tell them they have to do anything. That's human nature. So once you told them they had to,
Yeah.
of course they push back. But this is not a mandatory vaccine. This is something that if you want it, get it. If not, you can duck the flu on your own at your own risk. You know what I'm saying? But I choose to get it. And when I found out they had one for people of my age, I lined up for that too. So I took the shot. I just don't like being
Yeah.
sick. Let's put it like that.
Well, and neither do I. I'm so glad you mentioned malaria. So my parents are. I'm a daughter of Indian immigrants. When we went to India when I was a little kid, I hated taking those bitter horse pills and those malaria quit pills. They were so bitter. I ended up getting malaria when I got home to Toronto, and I was hospitalized for 5 days. I mean, I was lucky I got great treatment, but I hate getting sick, and I'm a doctor. I that's what I do for a living. I take care of other people who are sick. Interesting enough, yeah, during the COVID pandemic, they did mandate it because we didn't understand this virus. It was like, just attacking everyone. Although in the military, you had to get the vaccine, right? You guys were kind of told what to do there, right?
Yeah, you're kind
But
of like property of the United States government, and you just line up for it, So, but
yeah,
I said I never had any adverse reaction to any vaccine. So but like I said, even since I've been involved with this, there's certain people that have something against them, and I'm like, well, this is not for you, So do the
yeah,
flu
yeah.
vaccine. This is an Sanofi is an option.
Right. Well, and I got to tell, as someone who's taken care of people, many patients who've been infected by the flu or influenza, it's important for the public to know that this is not a benign illness or infection.
Mm-mm.
There are people who can get severely ill and who die. And why I think it's so important, I see that for you, of all people, to be using your massive global platform to be talking about something that matters a lot to me as a doctor.
Mhm.
According to the HHS and the Office of Minority Health with the Health and Human Services Department, Black Americans are less likely to get the flu and pneumonia vaccines, especially Black Americans that are over 65 and babies that are 19 to 35 months for the flu vaccine. Couple that with the high risk of flu-related complications, hospitalizations, and premature death, and the chronic, disproportionate chronic burden of diseases faced by far too many Black Americans. I'm just wondering what role, if any, did race play for you in promoting the vaccine and taking on this campaign by Sanofi?
None. None. I mean, black people, they have their feelings about vaccines. We have a history where black people use as guinea pigs. You know,
Yep.
so and when you're talking about people of that age, they were part of that time. So
Yep.
I understand that, and I'm not here to battle them about how they feel about it. My thing is that I just speak for myself, and I have no problem with it. I've been taking the flu vaccine for years and years and years. So that's
Yeah.
my thing. But I understand why, black people are very cautious about a lot of things,
Yeah.
because for years and years, black people were treated unjustly and they got, especially with pharma, different things, and nobody wants to be a guinea pig for something.
Well, 1,000%. In fact, studies are very clear that a lot of Black Americans and people of color face tremendous I'll just say just racism by the medical community. So my own community, to this day, there's a lot of discrimination. There's unconscious and conscious bias, and that's adversely affecting the care that a lot of Black Americans and other people of color receive, and that needs to change.
Yeah,
Um,
that definitely needs to change, but people are very cautious to even just doctors, like, you know what I'm saying? So it's unfortunate, but I think it's black. I think it's a lot of minorities
yeah,
have a feeling, a lack of trust. First you have a lack of trust in the government, then you connect that to medicine,
yeah.
and you've got a lot of people that aren't going to the doctor that should be going to the doctor.
Well, 1,000% on all of that. And I just want to say that I mean, in my community, the healthcare professionals, we are actively trying to address that and address that kind of the reasons for that mistrust. And I got to tell you, when someone like you, you're a man of color with tremendous platform and influence, when you give these messages about health and just share your own personal story as to why you got it, it's really as simple as, hell, you don't want to get sick. And remind me, Ice, but when you were in the military and now then decades later, you're in the entertainment industry, you guys don't exactly get sick days, right?
No, no, no. You don't get sick days, and being sick could shut down production. It can cause a big problem, and I just never wanted to be a problem. Dick Wolf, my boss over there, he always said iced tea is the least pain in my ass. So I make sure I'm on point. I do my job. That's how we ended up being the longest running television show in history. So I am very I'm health conscious. And as I get older, I'm more and more health conscious because,
Yeah.
I'm watching my friends 40 years old go, dying. And I'm like, come on, man, what's happening? And at 65, I'm out here doing everything I was doing when I was 25. I'm touring, I'm acting. I have a very active life. And I'm not a health food guy. I grew up for health food. I'm not big on that. I just do everything in moderation and try to stay active and just use my common sense. So this people use their common sense. Also, when we talk about minorities, you got to remember a lot of them don't have money, so they get the lowest form of health care.
Yep.
And it's different. I mean, I posted a picture of me getting a body scan, just checking on my the arteries and stuff,
Oh yeah. Yeah.
and people took offense to it because they don't have the money for that. So it's a very delicate thing when you speak to to my people, because they still, even though I am black now, well, you got money, so it's
Yeah.
different. I'm different, so I try to tread lightly.
Yeah, but at the same time, yeah, but it raises other problems and that need to be addressed, right? Everyone should have access to healthcare, and not just
Absolutely.
access to good quality, high quality healthcare. And you shouldn't be a person in privilege like I am, like you are. It should
Mhm.
be everyone. So that speaks to another bigger problem in the United States, that of the richest country in the world, we have the poorest health outcomes of all industrialized nations. And a major reason for that is because we don't have universal health care. Again, that's my opinion.
Well,
As
it's
a
sad. It's sad when you can't get taken care of. I actually, I had again a knee surgery. You
Mhm.
know, and I had insurance, and I was talking to one of my friends, and he was limping.
Yeah.
I was like, "Why don't you get it?" He said, "I don't have insurance," and the actual operation without insurance could cost like 50 grand. So it has a lot to do with money. People don't have money, and your life is going to be rougher. It's harder. So yeah,
Yeah.
universal health care should be something that should be forefront out here, but it's not.
Yeah, yeah. Well, my God, I can talk to you forever about the itself, man. Holy cow! I will say, Dick Wolf. I mean, you got to put that on your resume if you have one. The least pain in my ass.
I know. I have people that work for me, and that's the best thing I can say about them is that's the last person I have to worry about. They do not cause any problems. So when he gave me that compliment, I said, "Look, that's a great compliment from a boss. So I'm gonna try to stay that guy. No sick days."
Well, so speaking of getting sick, as you know, Ice, during the since the COVID pandemic, COVID was an airborne respiratory. Well, it was more than just a respiratory. It was an airborne virus like influenza. Um, Unfortunately, during the COVID pandemic and since that time, vaccine skepticism or the anti-vax movement has actually skyrocketed. I
Mhm.
wonder what message, if any, you have for people who just say, "Oh, I don't believe in vaccines."
I don't have a message for them. I mean, I'm not here to push that. Like, if that's what they feel, that's what they feel. I've learned that it's not my job to push anything on anybody. It's like do what you feel is right for you and your family. Even during COVID, a lot of people didn't want to take that. I'm like, hey, do what you feel is right. I'm gonna do what I feel is right. I think it's hard when you try to pressure people into health. Do whatever you feel is right for you.
Well, just by sharing your story, though, honestly, you are. I'm not going to say you're pushing because I also don't agree. I don't believe in pushing or making people feel bad or guilty into doing things.
Mhm.
But through storytelling, which you do very, very well, and through the science, which I know a little bit more of, combining these two, that's the best way to get people just to listen and for us, for people like me especially, to listen to people, not force information on them, but try to understand where they're coming from. And I think that's the best way to get trust. It's through empathy, it's through storytelling, what you've done for decades now in Law and Order, by the way, one of my favorite shows. um
I just try to lead by example. You know what I'm saying? Like I have homies that call me up, say, you got the flu shot? I'm like, yeah. They go, okay, maybe I'll go get it. So that's what it is. I'm lead, if that's what I'm doing, but nah, I'm not. You got to be careful out here. I'm not gonna pressure anybody to do anything.
Well, I just really appreciate that. And then two last quick questions. Ice, what message do you have for healthcare professionals about vaccines and other preventive health measures?
For healthcare professionals,
Yeah, folks like me, in terms of how I message, how we maybe talk to people about vaccines or other preventive health, any message at all.
no.
Okay. Simple. Thank you for making my life easy. And
You're good at what you do. That's your job. You know what I'm saying? So I'll let you do that. Who am I to tell a healthcare professional anything?
well, thank you, my friend. That really means a lot. I appreciate that. And my last question for you, my friend, is look, you wear a lot of hats, including the one you're wearing right now. Is that a
Mhm.
Yankees hat? I don't know what hat you're wearing.
That's the LA hat, but I don't even watch sports. It just represents where I'm from.
But it's just a metaphor. But you wear a lot of hats: rapper, producer, actor, husband, father, activist. There's clearly a little bit of stress in your life. What do you do for self-care?
Well, you just said it. I'm on a very low stress diet. What I first did when I first started to become iced tea, I had high blood pressure, and I found out that it was really stress related. And I just started to remove certain people from my life. In my life, I don't raise my voice. Everybody has to be very mellow. Anybody that works for me, we have to be very mellow. And I keep everything on a very even keel. And I do that. And like I say, I eat all foods in moderation. I just stay active. Fortunately, being on television, we work every day, so I'm active. I try to hit the gym.
Long hours too, though, don't you? I see
Yeah,
like 15 hours or something.
long hours, and I do my little workouts night and day when I get in. I just think the object is really stay active because
Yeah,
I could be on vacation and I could sit on my couch and play video games for a week, and when I stand up, it seems like I've been there for a month. It's like,
right.
yo, like when they say a rolling stone gathers no moss. Well,
As
you got to keep moving. You got to keep everything in your life moving because when you start to slow down, then things start to happen. So I've been very fortunate that I've been able to kick it and stay active. But that's my trick: stay active, low stress,
yeah.
as as and just really not letting people invade your peace because a lot of it's up here. A lot of it's up here, and you can, and then just being cautious. I'm one thing that did come good out of COVID is people start to kind of back off of each other. I've been doing the 6 feet even before COVID came out. So
Right. Yeah,
people not sharing that space, that's
yeah.
healthy. That's healthy. So,
Yeah.
strangers used to come up and get right in your face and
In
want
your face. Like, back
to
up.
back up a little bit. I don't know what you've been up to. So,
Well, yeah, I agree with you. I've said this several times. I said there are actually several positives that have come out of COVID. I mean, it's unfortunate that so many thousands, millions of people had to die and get sick, but there are several positives. I also think that because of COVID, more people are just practicing just good hygiene, like
Absolutely.
washing their hands, keeping a distance, covering when they cough, even wearing a mask, like when they think that they're sick, or avoiding public crowded spaces to keep other people safe. So, I love, by the way, the examples you shared of your self-care. I gotta tell you, I feel like I want to give you an honorary medical degree because I say the exact same things. You talked about a good diet, just healthy foods, things in moderation, not having a sedentary lifestyle. You're pretty active, the other thing I read about you, and please confirm this if it's true, especially as an addiction medicine doctor, I'm curious, is it true that you avoid cigarettes, alcohol, and just other substances?
I never drank. I never smoked. I never got high. That's not my thing. I'm pretty straight edge when it comes to that kind of stuff. I'm not afraid of it. I'm an orphan, so I just felt that anything like that might compromise my safety because when you get drunk or high, you're putting your hands in somebody else, and I never had anybody, so that was one of the reasons I stayed straight. But you know, that works for me. That's what works for me. People always ask me in relationships, they say, well, you've been married to your wife for 24 years. How do you do that? I say, I know how to be married to my wife. I don't know how to be to your wife. So this procedure works for me.
Yeah.
And everybody's got to find out, what works for them.
Yeah.
People have decided, well, this will be the diet. I won't eat meat. I won't eat that. I won't eat. Okay. I also think it has to do with your mental health. Because if I take away my tacos, I won't be happy up here. And that's going to send everything downhill. So
Tacos for you, for me, dude, it's don't take away my chocolate or my desserts, okay?
so
So, um, is there anything else that you want to talk about that I didn't ask? Anything else?
no, not really. Just really, like I said, I'm just really more about, men. They look at me, oh, I see the macho dude, this, that, and the third. But I'm just saying, go do your checkups, go, colonoscopies, all that kind of stuff, because you want to stay around here. There's no reason people are checking out in 40s and 50s and stuff. And a lot of this stuff is early detection. If you can, one of
Yeah.
my best friends found out he had cancer, and he was able to cure it. So early detection. So start going to the doctor, maybe even if you just start off 2 or 3 times a year, and then
Yeah.
you start picking that up, go every other month, get yourself checked out. You know, yeah, it's nothing soft about that.
Well, not only is it not soft, I would say it's literally life-saving.
Yeah.
Studies are very clear that men just tend not to go to the doctor, and as you pointed out, almost comically, but rather true, that men wait till the very last end, well, until they're on death's door.
You think
Uh,
that's why women outlive us?
what's that?
You think that's why women outlive us?
Women outlive men, but you know what's interesting though, Ice, is that it turns out that married men live longer than single men. And why is that? It's
I know
because
why. I know why that is. Yeah,
why?
running in the streets is not healthy. You gotta settle down.
And it's because they have a woman taking care of them.
Oh,
Whereas
see,
the opposite is not true. Single women live longer than married women. So, and they're happier. So who knows? But I just want to say that but men tend not to
married
see the
woman is
doctor.
taking care of the man and not herself. I get it. Hey, well,
Yeah.
look,
Yeah.
look. Hey, all those statistics we can be different. We can throw them off too. This,
Absolutely.
yeah.
But you've shared so many key messages, Ice, about health, about wellness, about just being yourself and just doing what's right for yourself. I cannot thank you enough. Especially as a doctor and a public health advocate and communicator, you don't have to have the letters MD behind your name to be saving lives. And I can call you Dr. Ice T. Okay.
Well, I got a friend, Dr. Dre. We all doctors nowadays, so it's all. Thank you for talking to me.
Thank you so much for this. I love this conversation. Thank you.
All right, pleasure.
Thank you. Folks, as you just saw, Ice-T was as cool as a cucumber and smart as a whip. He may have a reputation of being tough and intimidating, but he couldn't have been nicer. Ice-T is not only a talented musician and successful businessman, but he also understands the importance of health, both physical and mental, and specifically preventive health. You heard Ice-T. He said, "I don't want to get sick." He knows that vaccines are effective at reducing the risk of infection, illness, and death. Yet sadly, less than half of US adults are vaccinated against influenza, despite last season being one of the worst flu seasons in US history. From a health equity lens, the data is pretty dark. According to the CDC, flu-related hospitalization rates were 80% higher among Black versus white Americans from 2009 to 2022. In addition, less than 43% of Black, Hispanic, and Native American adults were vaccinated during the 2021-2022 flu season. I know the medical community must do more to gain trust among communities of color. But I also firmly believe that when celebrities like Ice-T share their stories about getting the flu vaccine and urging men to see the doctor, it will have a positive impact on marginalized communities. Ice-T is truly a public health ambassador. So, how can you make a difference? You can learn more from organizations like the CDC, vaccines.gov, the World Health Organization, and your local city and state public health departments. Well, that's all for today. Now here's your joke of the day. What happened when the doctor advised the patient to stop using a Q-tip? Well, just went in one ear and out the other. Be sure to subscribe to my YouTube channel, rate comments below, and follow me on Instagram at Health, Humor, Harmony, Dr. Roy. Be well, and I'll see you soon.